Welcome back to Cycle Wisdom, where we empower women to restore natural cycles, to improve health, and promote fertility. I'm your host, Dr. Monica Minger, and I am so glad you are listening today. On today's episode, we're going to continue our conversation about Polycystic Ovarian Syndrome by discussing different treatment options and what this means specifically in regards to menstrual cycles and fertility. We're going to pick up again with the story of Paula, who we introduced on last week's episode. Now that Paula had an appropriate diagnosis of PCOS, we discussed further what her goals were in regards to her cycles and fertility. She was hoping to achieve a pregnancy, and so I let her know that we were going to focus first on getting her menses and ovulation more regulated, so she was at a better point of cycle health. Ultimately, the goal would be to allow fertility to happen naturally after her cycles were regulated. So we started off with focusing on the areas where Paula could adjust some of her daily lifestyle habits, primarily in the areas of her diet, activity level, sleep, and stress. Now, these are things that we talk about for overall good health, not just for menstrual cycle irregularities, but they are so important to keep at the front of our minds. In our last episode, we talked about evaluating for insulin resistance, which can manifest as elevated blood sugar readings and can commonly be seen with a diagnosis of PCOS. Since Paula did have concerns for this on her blood work, one of the dietary changes we talked about with her was how to eat a more well-balanced diet, decreasing her overall carbohydrate content and focusing on good, healthy carbohydrates, which included whole grains and increased fiber content. We also spent time discussing how to make sure she was balancing those good carbohydrates with protein at every meal or snack. So for those of you who may not be familiar with working through that and understanding the dietary part of things, working with a certified nutritionist or dietitian can be really beneficial for helping to get you on the right track. I do want to reiterate here that not all carbs are bad carbs. We do need carbohydrates in order to function. And so sometimes I find that people go on either a completely restricted carb diet or do really low carb. But that doesn't always fix this underlying problem of insulin resistance, and in some cases, it actually can make it worse. You do need to have some carbohydrates and starches in order for your body to function normally. And so really understanding that and working with somebody who specializes in that is incredibly important. After we got Paula on the right track with a dietitian consultation, we talked about the importance of exercise in regards to her overall physical and emotional health. I asked her to aim for exercising more regularly, at least 30 minutes per day for 5 days a week or more, where her heart rate would be increased. Ideally, we would add in some resistance or weight training as well to help maximize her exercise efforts and promote good health long term. Equally as important as diet and exercise, we discussed with Paula the importance of getting adequate sleep. Because of the busy lifestyle that many of us lead, we often are getting interrupted sleep or sometimes just not enough sleep at all. What we find is that focusing on good sleep hygiene can make a huge difference in your physical and mental health. And finally, we discussed Paula's stress levels and ways that we could help to reduce that stress in her life. Certainly, getting enough sleep and exercise would be helpful, but we determined that she was actually dealing with a lot of emotional stress that wasn't being well managed. We were able to get her referred to a specialized therapist to talk through some of the stressful situations she was managing and give her the tools to cope with that stress in a more productive manner. Once we had a good decision made in place about the lifestyle changes that needed to happen, we were then able to turn our attention specifically to medications and supplements that Paula needed in order to help get her hormones, metabolism, and cycles back on track. So let's talk a little bit about some different treatment options. As you can imagine, there are, of course, many different options depending upon your goals and intentions with your cycles after a diagnosis of PCOS. And as you may understand by now, my goal is always to try and treat things in a more natural way, to get things back to what baseline should be, not only based on those lab test results, but also what we see occurring with your natural menstrual and ovulation cycles. Now, one of the things we want to specifically pay attention to is correcting that underlying insulin resistance we've talked about, because that can really drive a lot of the other factors here, especially in regards to the hormones of testosterone, progesterone, and estradiol, all of which are important for regulating the menstrual cycle and helping ovulation to occur more normally. So correcting those insulin resistance issues can sometimes mean starting on medications in addition to the dietary changes we discussed. I do utilize metformin as a prescription, which is a common diabetes medication used to help with insulin resistance or excessively high blood sugars. There are other situations where we may recommend certain supplements depending upon your case, if you are not wanting to take metformin or if you have negative side effects with it. Another piece that we manage is addressing any additional hormone imbalances that may be playing a role in PCOS. And one of the common patterns we see is a mismatch of LH or luteinizing hormone to FSH or follicle stimulating hormone, where that ratio can be elevated. Typically, we used to say that if you had an elevation, it was diagnostic in and of itself, and you didn't have to do anything else for a diagnosis. And really what we're finding more and more is that's not the case in all women, but it certainly can be one indicator to look for. When we do observe that ratio being off, it leads me to look deeper into making sure that you're ovulating on a regular basis. And that's another important point that we see with PCOS. There often can be an additional ovulatory dysfunction occurring because there are so many developing follicles that are never rupturing and continue to be the multiple cysts that we see. Because of this ovulatory dysfunction, we oftentimes will use ovulatory stimulation medications such as letrozole or Clomid to help encourage your body to ovulate each cycle. This helps to positively impact the developing follicle for that particular cycle, as well as encourages the remaining hormones to move in the right direction at the appropriate times. Now, another piece I want to talk a little bit about is progesterone levels, because we oftentimes will see a progesterone imbalance in people with PCOS. Most often we see progesterone levels are running too low or estrogen levels are too high, and we often will see that run alongside PCOS. If this is the case, we often supplement with bioidentical progesterone to support your cycles, especially in that luteal phase, the time frame directly after you ovulate. Again, this is really important for making sure that not only are your cycles back to a little bit more normal length, but also will help hopefully trigger a message to your body to ovulate more normally in the upcoming cycle. More importantly, if you're trying to get pregnant and have PCOS, the progesterone medication helps to ensure that progesterone levels are in a good range leading into that pregnancy to be able to allow a developing placenta to form well. The placenta needs to be able to get the nutrients in order to keep baby nourished early on in the pregnancy. Now, one of the more common questions that I get asked a lot when it comes to PCOS is in regards to fertility. Many women have been told that since they have PCOS, it's going to cause infertility, or they're going to have a harder time with getting pregnant. My answer is typically that a lot of that is really dependent upon what your cycles are doing, what your ovulation pattern looks like, as well as what the hormone lab evaluation shows. Now, certainly we can see an increased number of issues with fertility in women with a diagnosis of PCOS. However, these are all issues that can be addressed by working through whatever's going on with your cycles, getting the appropriate diagnosis, and getting an adequate treatment plan in place. Because as we have seen so many times, correcting any underlying issues, whether that's metabolic, hormonal, or ovulatory, will all help to encourage your body towards better health and promoting natural fertility in a way that corrects those underlying issues. Now, I am happy to report that Paula was able to achieve a pregnancy without any artificial reproductive technologies after working with us for a few months on lifestyle changes, as well as getting that appropriate diagnosis and treatment plan in place. She did end up requiring some additional progesterone support throughout her pregnancy because her levels had been quite low leading up to getting pregnant, which is commonly seen in PCOS. The other beautiful thing about Paula's story is that by correcting her underlying menstrual cycle abnormalities, she was able to continue charting her cycles again after her pregnancy and had a better understanding of how to utilize her charting in order to avoid pregnancy for the time being. Now, if you're ready to find the answers you need for your menstrual cycle irregularities in regards to PCOS, I would invite you to come work with us. We have helped many individuals with PCOS over the years, and I would love the opportunity to help get you on the path to healing through a correct diagnosis and an individualized treatment plan. Go to our website, radiantclinic.com, to learn how our care model for natural women's healthcare can benefit you. From our website, you may also schedule an in-person appointment to see me in the Cedar Rapids area, or arrange for a telehealth visit if you live in the state of Iowa. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content. I sincerely appreciate your support, and I look forward to sharing more with you on our next episode of Cycle Wisdom.